Good morning, everybody. Oh, that is a chilly more welcome. Good morning, everyone. That is a lot better. I mean, the day has delivered. It's a beautiful autumn's day in Berlin. We have a blue sky, and we're in for some engaging conversations. So I think there's something to be a little bit excited about this morning. I would like to welcome you again. We officially opened yesterday, but I'd like to welcome you again to the World Health Summit 2022. We're still in the midst of a pandemic, and I heard in the opening remarks yesterday that we've got to heed the lessons of this pandemic. I heard that if we take our science and our solidarity, that we could build the strong and resilient health systems that we need today. And indeed, that is what G7 nations have set out to do under Germany's presidency of the Group of Seven. And so in this session, we're going to be looking into that. We're going to be putting a spotlight on global health under Germany's G7 presidency. We're going to look at the road ahead as we prepare ourselves for G20 in Indonesia, and of course, Japan's G7 presidency in 2023. My name is Christine Mundwa, and I will be your facilitator of this discussion this morning. I like to say I hail from the great Zimbabwe, and it's always a great pleasure to be in Berlin. Ladies and gentlemen, global health had a central role within the G7 under Germany's presidency. And this year, the Group of Seven put a focus on three particular areas, and I'll just take you through those very quickly. It was pandemic preparedness and response, tackling the increasing rates of antimicrobial resistances, what some of you might call AMR colloquially, as well as adapting our health systems to climate change and climate-related health risks. And so without wasting any more time, I will now hand over to my first panelist of the day. But before I do that, I perhaps will just introduce all of them today. Our speakers and our panelists are made up of assistant or deputy officials in the health ministries of the G7 countries. We have Dr. Thomas Stephan, who is State Secretary at the German Federal Ministry of Health. Dr. Stefan Lucas is Deputy Minister of Health in Canada. Mr. John Ryan is the European Union's Acting Deputy Director General for Health. Mr. Antoine Saint-Denis is France's Director for European and International Affairs in Social Ministries. Dr. Satoshi Ezo is Japan's Director of Global Health Strategy, that particular division in the Ministry of Health. Ms. Clara Swinson is the United Kingdom's Director General for Global Health, and Ms. Lois Pace is the United States' Assistant Secretary for Global Affairs. If you were counting, you will know one is missing, and that is not missing necessarily, but our friends in Italy are joining us virtually. They are with us on the platform, and they will be passively participating, listening to everything that is said. And when we veer off course, they'll jump in to correct us. But that is our panelists for the day. And Dr. Stefan, I want to hand over to you now, because I would like for you to say a little bit about the deliverables that G7 health ministers agreed to, that you all committed to under Germany's G7 presidency.
Hear me?
Loud and
Good
clear.
morning to everyone, and Madam Moderator, I cannot see you, but fortunately I can hear you. So I will use the room micro to also use the opportunity to say good morning and welcome to all of you, and a special welcome to my G7 colleagues. I'm more than pleased, and I'm honored that you all came over and joined us here in Berlin. And maybe allow me a little bit, because I'm very sure we will discuss the three top issues that we delivered already in the May communiqué. And you mentioned the three main topics about pandemic readiness. How can we better prepared for the next pandemic? And second, how to fight antimicrobial resistances, and third, what to do about climate change and all the health-related issues that we will come back to these very important issues in a second. And I'm very sure my colleagues will give their input and will inform you also about the next steps. And I'm more than happy that also Japan is with us and will tell us more about the year 2023, because we are all working under the principle of continuity, which is very important in today's times. But let me just stress very briefly 3 other important issues or deliverables for the G7 presidency. The first one is that we are living in a world of turmoil. And in the world of turmoil, it's more than important that the G7 countries meet on a regular basis and also in person. You know, we all like those virtual meetings, but you cannot compare it with a meeting in person where you sit together and you really have the chance to discuss things together with colleagues face to face. We did that on the level of ministers in May, and we did it again on the level of the deputies yesterday. So it's about building trust in a world of turmoil. And again, we see how many values we share in these 7 countries. And it's not about just 7 countries. We have the European Union, the European Commission with us. So it's much more than 7 countries standing behind us. First point. Second point, I'm always impressed. And if I compare that with sometimes also G20 meetings or other international fora, it is in the G7 about technical issues, which sometimes are very, very complex one, but also strategic issues. Just take the point of Ukraine and how we can work together with Ukraine. We have an ongoing dialogue about how to best coordinate also our health ministries to rebuild the health system of Ukraine better than it was, and how to reform and how to better help the Ukrainians to deliver the health service to the Ukrainian citizens. This is a medium to long-term vision that we share with Ukraine, and we have to work on that together. So it's not just for Germany or for France to have a bilateral contact with Ukraine, but we have to bundle our forces and to make the best out of it and help Ukraine. So the mixture of technical issues and strategic and political issues is really what matters for the G7. And maybe a last one, and I'm saying that because I've spent half of my time in the finance ministry. We in the G7 really discovered how important it is to define problems, challenges, but also solutions on an intersectoral basis. And we have a very regular discussion between health ministers and finance ministers, but you can have the best strategy for health. If it's not funded, you can go home and nothing will happen, and nothing will change. And that is why we are more than happy, together with our friends from the G20, and we will meet them next week in Bali again, that we have a health and finance task force, which is standing, which is working, and which is also discussing the pandemic challenges and how to overcome them. So again, to bring together expertise, health expertise, and at the same time to see how we can fund the implementation of our strategies is a very important achievement of the G7, and I'm very sure we'll continue with that kind of approach under the next G20 presidency and under the next G7 presidency. Thank you.
Thank you, State Secretary Stefan. Ms. Winson, I'd like to come to you because the UK handed over the G7 presidency to Germany. I heard the word continuity as State Secretary Stefan was speaking there, but I want to zero in specifically on pandemic preparedness. Could you talk us through the commitments that were agreed upon in this regard, and the follow-up, the steps that follow that, if you will, and also in line with the continuity aspect, if you could tell us about some of what the UK had put in place that then followed through to what came out in the previous communique.
Sure. And yeah, sounds like that's working. Good morning, everyone. And a huge thank you to Thomas and our German colleagues for both hosting us here, but also, just as the question poses, for taking continuity from our presidency last year. G7 works really well when it's aligned, when there's a common aim, and I'll say a bit about pandemic preparedness for that. And of course, moving on to working with Japan as well. Of course, we've been through a lot over the last 3 years that I think has really helped that alignment, the focus on pandemic preparedness, but it is about the actual things that we can do together to prepare both for response, for smaller outbreaks and events, but also for pandemic preparedness. So specifically on that, as you've asked, the Pact for Pandemic Preparedness, which was agreed by our ministers earlier this year, I think is a really good vehicle for showing the different things that are going on, of course, in country and internationally. Through the pandemic, we've put lots of individual things in place. They are all good things. They're all attempts both on surveillance and response and things that we used in the emergency, but now really thinking, how do we put those together so that there is a coordinated base of surveillance and working with the WHO as well, how there is a coordinated base of response. So I'd really point people to the Pact for Pandemic Preparedness Readiness that does that. From the UK, a number of things that we had in the communique from the year before. There was the 100-day mission, looking at how to get vaccines, from day one through to accelerated use within 100 days. That is a super challenging target, but government, civil society and academia, research, industry, all working together for that. So we've picked that up. The International Pathogen Surveillance Network from our presidency, and the very much a One Health approach, both on this pandemic response and of course, the silent pandemic of antimicrobial resistance. So I would focus on those things from our presidency that have been taken forward. And I would just also really agree with Thomas that the strength of what we have done together and will continue to do is both on the technical level and the strategic level. And it is something where, we've got fantastic teams, both on the overall response and what workforces have been through in response to the pandemic, but technical teams, the public health workforce in all of our countries is absolutely foundational to what we can do together. So putting technical experts in good networks, they're the ones who really know what to do and respond is a really important thing within a strategic framework that all of our ministers can sign up to. Thank you.
Thank you for that. Misu Santini, if you will allow me to do. One of the other three priority areas is the increasing resistance to the antimicrobials. And that is also where commitments were made. Could you talk us through some of those commitments? I happen to know that that was a really important one for France.
Yes, I just speak. Okay. Hello, thank you, and good morning, everybody. It's an honor and pleasure for me to be here. Yes, I confirm that we are particularly committed to on this issue, and it's clear that one of the main added values of the presidency has been on this area to bring together member states and a number of several international initiatives, so that we hope that this mixture of political will and technical work, which is instrumental to deliver, will have concrete results in the upcoming years. We have a big challenge ahead. This was explicitly highlighted in the ministers' meeting last May, and there is a lot of work to be done, a lot of financing to be organized so that we can protect our populations against this increasing resistance to antibiotics.
Thank you very much for that. Dr. Lucas, I'll come to you because just from Canada's perspective, staying on AMR, if we can do that. Could you also expand on the steps that now follow the commitments that were made in the Communiqué under the G7 presidency of Germany. And please perhaps share some insights into Canada's experience with the surveillance systems as it pertains to AMR.
Thank you, and good morning. First, I would just like to recognize the leadership of Germany in G7. I think it's been a very important year in terms of bringing that leadership forward at the strategic level in terms of the overall global architecture, recognizing the role of the World Health Organization in terms of pandemic preparedness and response. Similarly, on antimicrobial resistance, this is a long-standing challenge that, in a sense, flies under the radar, as noted by colleagues, a silent pandemic, but critically important for Germany, the champion in the G7, with full support of all members, as the UK had done previously. I think here that it works on a number of dimensions, from creating awareness, so the public is aware, to addressing challenges and risks in healthcare settings, in hospitals where we can have stronger infection prevention and control, through to looking at the use of antimicrobials, not only in the human health sector, but in the veterinary sector, where we're seeing significant overuse driving the resistance. Mm-hmm. I think looking ahead, a couple critical dimensions highlighted in the work of G7 and recognizing upcoming fora, both under Germany's leadership, but importantly, heading towards the 2024 UN high-level meeting on AMR. Focus on research. We need new antimicrobials. The pipeline is relatively barren, certainly compared to other areas, and we need to see significant development there, and global collaboration between researchers and with the private sector is essential. But importantly, and a key area of focus in Germany's presidency, discussed by ministers last spring, was on the innovative financing mechanisms to pull antimicrobials forward, and I know a number of countries are demonstrating those. In Canada, we are updating and advancing our strategy, and I think one of the great advantages of G7 collaboration is learning from each other's experience and the leadership of countries in this regard. It's given the global challenge. Finally, on the area of surveillance, as you noted, certainly one of the things that grew from the pandemic was the recognition of different surveillance systems, and a key one is wastewater surveillance, which has been used in Canada and G7 and other countries around the world to affect in detecting COVID. Yeah. And understanding its genomic signature. We're now looking at applying that to antimicrobial resistance, as well as other infectious diseases, for example, monkeypox. And so working at the strategic level, recognizing the fundamental importance, and the technical level, as noted by colleagues, will help us advance on this important priority.
Thank you. So we've done pandemic preparedness, we've now done AMR, and Mr. Ryan, I want to come to you now because there was also climate change. The G7 committed to ensuring that health systems would adapt to climate change. Please shed some light on that for us.
Yes, I think climate change is really one of the major challenges it's going to face our societies and globally in the coming years. We've talked already about antimicrobial resistance. We've talked about the threat of pandemic preparedness and being ready for these pandemic threats. I think there's probably a lot of work that needs to be done in terms of identifying the nature of the climate change threat in respect of health. And therefore, in particular in the European Union, we've established an observatory for climate change and health, which we hope will be able to exploit the data which is being collected on both sides and to make those linkages. We've seen in recent years the multiplication of extreme weather events here in Europe, and this obviously is much worse in other parts of the world. So I think one of the leadership roles of G7 will be to really put the spotlight on this issue in the coming years, and to see how we can identify interventions in our health systems which are validated, which are shown to have an effect, and which can help countries to prepare themselves for this situation, which I'm afraid will be rather inevitable and will increase the burden on our health systems considerably in the future.
Right. So an increased burden that we anticipate on our health systems. Ms. Pace, when we take into account the 3 priority areas that we have just discussed and the commitments that were made to that, we also factor in existing initiatives in these spaces. Under previous pacts, how do we align these initiatives?
Well, that's what's so important about the continuity of this work, right? Is ensuring that we're not just putting additional ornaments on the Christmas tree, but really thinking about how we can connect the dots or build bridges from the UK to Germany to Japan. I think one way that we also try and look at those intersections is to think about other places where we interact with one another. So while we work together, obviously, as a group of 7 or 8, we also really are able to come together in spaces like the World Health Organization, right? Like the G20 for that matter. And so I think, as Thomas was saying in his introductory remarks, there's an opportunity for us to think about how this connects to other really important issues, like how we build on or otherwise improve the global health architecture, how we help strengthen the World Health Organization and its various initiatives, or how we otherwise just do right by the world. And if I can just step back and really reflect on Germany's really important leadership in this space, I think we've often acknowledged, at least to them privately, how impressive it was they were able to lead us through this moment, as was the UK, in crisis. It was really, I think, an important moment for the G7 to step back and ask if we got it right. And I think if we're being honest, we know that a lot of us fell short in this crisis. And I think it was our responsibility or obligation to really look critically at how we can improve on that and ways that we ensure we do better by the world moving forward. And so thank you both for holding us to that, and thank all of you in this room, actually, who helped us think and look critically at an important time. This could not be work that we did business as usual. And I think we felt the pressure ourselves, but we also felt the pressure from many of you who held us accountable, and I think should continue to do that.
Dr. Ezoe, I'm coming to you to get a sort of throw forward, looking forward. But before I do that, I just want to maybe touch base with my other speakers. Would you like to add something to this round where we've been reflecting on Germany's input before we go to sort of throwing forward? Anybody? Okay. So, Dr. Ezoe, Japan will be taking over from Germany. Could you talk us through the thinking about continuity in your presidency, and perhaps when you reflect upon that which has been done this year, are there some gaps that need to be filled that Japan will specifically be looking at?
Thank you. My name is Satoshi Ezoe. I'm actually from the Foreign Ministry, but although I was affiliated by the Health Ministry, and I'm now also affiliated with the Cabinet Secretariat, so I hope to be able to share some preliminary ideas towards the next G7. But before doing that, I just wanted to acknowledge and recognize the German leadership for this presidency. They did a great job maintaining and even strengthening the momentum for global health in spite of the geopolitical situations from February. So, and that is a remarkable thing to do. When you think about the pandemic is already a very complex business to tackle. So we just want to highlight that before I go into my presentation. So this is a preliminary ideas. So we respect the continuity of the G7. So we are not yet in a position to sort of officially announce the priorities, but just to share some initial thinking based on the discussion so far. I think we would have 3 broad areas. And then this is not to create a new initiative from scratch, but just based on the discussion so far. And one area, obvious area, would be the global health architecture for health security. That's the prevention, preparedness, and response for the future pandemics. And there are a lot of different discussions and streams going on under this agenda. One would be the INB, the new instrument for pandemic under the WHO, and also IHR amendment. This normative work is going on, and another one is the what to do with the ACT accelerator. That is as a founding donor. Alongside other G7 members, we are really committed to kind of a transition that into a meaningful platform. And so that discussion is also relevant in this space. And also the 100 Days mission that the UK initiated 2 years ago under the UK's presidency. Excuse me. Would be another area that we can still carry on to make it a meaningful R&D platform. And also, as mentioned already, the financing for pandemic is also under discussion, mainly under the G20 in terms of the health and finance task force. But there's this obvious development on the creation of FIF for pandemic, preparedness, prevention and response under the Indonesian leadership. And so we want to also capitalize on that development as G7. And in relation to that, there's this discussion around formalizing that task force, health and finance ministries, to make it more permanent platform, like a coordination platform for PPR. That's still under the discussion, but we want to somehow, incorporate that. And also there's this another discussion around whether and how to create this leaders level council. This is, there are different ideas around that in relation to the WHA or the UNGA or both. And so it is still in a discussion, but that discussion might be also relevant in this space. And the second area would be universal health coverage. So this has been sort of a joint agenda as an overall overarching goal for health. And but frankly speaking, this has been, the global community has been so busy tackling the immediate crisis of COVID-19. The universal health coverage has been, well, understandably not in a high on the political agenda. So we would want to try to highlight again in the context in changing phases. So under the UHC, we would, we could discuss, other long-standing health challenges other than COVID-19, like the PMNCH or other infectious diseases, like 3 major diseases, or the neglected tropical diseases, or non-communicable diseases, or life course approach, including healthy aging. So these, long-standing health challenges towards the SDGs could be highlighted again for the post-pandemic era. And also, in doing so, we would be, it would make sense to revisit the existing financing mechanism alongside FIF that could include Gavi, the Global Fund, the GFF, UNITAID, and other initiatives. And we want to leverage those global health initiatives in a coherent manner towards achieving universal health coverage. And as mentioned, there will be a high-level meeting on universal coverage next year in September. And so it would be, we want to try to beforehand, try to have at least a G7 common understanding towards the high-level meeting, so that we can facilitate the maximum impact from that high-level meeting on UHC. And the third broad areas, this could be cross-cutting, but the R&D and innovation is another area that has been already discussed at the G7, the Germany and the previous presidencies. And this could include AMR, mechanisms, financing mechanisms, or other R&D discussions. And I will not go into details because this is just, as I said, the skeleton that should be fleshed out with the inputs from the G7 members, especially from the current presidency of Germany, and also from the global community, global health community as a whole. So we are really open to inputs and advice, and this is no way set in stone. This session itself is very very informative for us to really crystallize the agenda towards next year. And just to share some logistics, so the G7 Hiroshima Summit will be in May, and then the Health Ministers meeting, the dates for the Health Ministers meeting is not yet decided, but it will be in Nagasaki. So it will be in Hiroshima and Nagasaki. And so we want to capitalize on those contexts as well. So thank you, and looking forward to your advice and inputs and discussion. Thank you.
Thank you, Dr. Zoe. So that is an invite to all of us to weigh in for Japan. I want to take a moment now to tell our friends online that you are also going to be invited to take part in our Q&A. We have a slot specifically for you, our online audience, for your questions and answers, and obviously to you guys in the room as well. And can I just see right now by show of hand, just to get a sense of how many questions we might have on the floor already? Okay, I see 2 hands now. Friends online, you could please write in the Q&A function on the service that you are joining us on, the platform that you're on. I have a tablet with me here, and I can see that as it's coming in, and I will bring that into the conversation. I did perhaps, before we get to these questions, and I promise I'm coming to those, but I wanted to maybe just get from all of you just input about how we can take all of these efforts, all of these initiatives, and make sure that they have a global reach, that they go beyond G7 countries, because as COVID-19 has shown us, we were all impacted. This came to the whole world. So perhaps I'll start with you, Mr. Santini.
Thank you for this question indeed, because that's a major goal, objective. We must ensure not only equity, but also inclusivity in our discussions. So in fact, that's one of the points we discussed yesterday, how we ensure that the views we share in the G7 liaise with the views that are elaborated in the G20 and are consistent with the work being done within the different international organizations, including, or first of all, the WHO. So that's a major point for us collectively, if I may say, and certainly for France. To me, this point is also in relation with the point of governance. We know that in order to improve our capacity to respond to the basic needs of the human beings in our world, but also the capacity to prevent and respond to pandemics, we need more money, but we also need better governance. And for France, this means that we must primarily rely on a number of existing institutions, primarily the WHO, whose efficiency must be still stimulated and improved. But as some of our colleagues said yesterday, we must be careful not to have enough objects in our hands as tools to work on, but also not too many. Otherwise, we might have a problem in terms of governance, in terms of organizing the responses, you see. And within these tools, there is room for everybody, but at the same time, some tools are more appropriate than the others in terms of efficiency, but also in terms of accountability. So this is a key point indeed.
Ms. Lois?
Yeah, I appreciate this question. So one of the ways we tried to do this the past couple of years was by integrating the work of the G7 and our inputs into this process into kind of bigger, if not bolder initiatives. One example of that was through the global COVID summits that we were co-hosting with not just G7 partners, but also G20 partners and the heads of AU and the like, to really show that this needs to be, as you said, sort of a whole of globe effort. Another way I think we do that moving forward is by incorporating these commitments and conversations into negotiations like around the pandemic accord, or even for the amendments to the international health regulations. I mean, that's really where the rubber hits the road when it comes to data and surveillance or One Health or other really critical areas that we were able to focus on as part of the G7. And it's not just in health areas too. I want to be sure to really talk about ways where we also show up at the climate conference, right? And really bring these issues into those spaces so that we're working across sectors. And so there are a number of areas, you know, outside of WHO and G20 and the like, where I think we are showing up and trying to make sure this is most inclusive. But again, you know, we're open to ideas as to how we do that even better.
Thank you. And I'll try and be brief. I agree with my colleagues on the points that they've made. And I think, you know, clearly the G7 has a responsibility in terms of financing, in terms of technical expertise, but it's got to be, if, you know, the last few years have shown us anything, it's got to be a global response. I'll just pick up two things. One is welcome what Japan has said about universal health coverage. That is the, you know, there's both about response to emergencies, but that is the foundation and the SDGs of what we're all working towards through whatever route countries can take, and also through outbreak management, through infectious disease, non-communicable diseases. So working on all of that. And the second one is clearly through the WHO and thinking about the work between now and May for the Assembly, which obviously has all countries to think about both what needs to be done on the regulatory side, the IHRs, but also on support, collaboration towards the SDGs. Thanks.
Thank you. Dr. State Secretary Stefan?
Yes, thank you. Thank you for that important question. And of course, it goes without saying that the G7, we are not living on an island, and also the European Union is not living on an island, because we are part of this complex world. And of course, in the sense of your question, we always have to look at the global dimension of what we are doing. And to give you two examples of what we mean is exactly what also my colleagues just described. We have a good and close relationship between the G7 and the G20, and we will continue with that. For example, we had our discussions on a technical level on pandemic readiness last week here in Berlin. We talked about surveillance, collaborative surveillance and systems. We talked about workforce and the training of the workforce and how to organize that. And of course, we have invited the G20 presidency to join us, what they did. And as one example, it's just one example, it's not an exclusive example, we also invited India as an important G20 partner to join us and to give us their input. And we will continue with that kind of cooperation. Also, when we go to Bali next week, we will have a lot of discussions with our G20 colleagues, exactly because it's what you said, it's the global dimension that matters. But of course, on the other hand, we cannot wait until we have a perfect concept discussed on a global level. We also have to lead by example as the G7, and to make some good progress, and then convince others that this is the right direction to go. So both is right to say we have to do something as G7, but not exclusively, but inclusively to the extent possible. And the second example is what was also just mentioned about the role of the WHO. the G7, we all share the principle of multilateralism. And this is a very, very important principle, which sometimes in the past was not taken so seriously, unfortunately. And of course, we have to come back to that kind of coordination and collaboration on the basis of multilateralism. And that is why it's also embedded in our communiqué in May. We have to further strengthen the WHO. It's the only health organization on a global level. We all know that we have very important strategies and goals with the WHO. We all know that the WHO is underfunded, to be honest, and we have to do something about that, because funding is very often very closely linked with the question of independence and predictability on a global level, and together with multilateralism is a very, very important principle. And that is why we also have to work together as the G7 in the frame of the WHO and further strengthen them. Thank you.
Dr. Zoe?
Sorry, can you repeat the question?
Oh, yes. The question, sir, is how do we
I see.
make our initiatives go global and not just go beyond the G7?
I see. Thank you. So I agree with everything that was mentioned with the previous speaker. So I didn't mention WHO, for example, but we thought that was given. So it doesn't mean that we don't take that seriously. So WHO's central role in the global health is fundamental, and we will continue that continue discussion with that basis. So we just heard from German presidency that about their relationship with the G20. So we are, as a whole G7 construct, we are still in discussion around the outreach. So usually, as the previous presidencies did, usually we invite member states and the institutions other than G7 members to the G7 summit. And we have done as for the health ministers meeting as well. So we are still in a discussion, but we hope to be able to outreach to other stakeholders and partners. And that's one way we can ensure the wider constituencies and the discussions with them. And one great example was the relationship with the G20 presidency that was just mentioned. So we will try to continue that tradition, although this is not decided yet. But it is, well, G7 is a member of the G20, so naturally we are in close coordination with the G20 as well. But it would be good to have a explicit collaboration with the G20 presidency of Indonesia this year and India next year. Thank you.
That's great, thank you. I'll make three brief points. One, I think under the German presidency, the Pact for Pandemic Readiness and Response is key because it brings together a more holistic, integrative view and with a roadmap being developed that helps link together and create a broader view on a whole series of global initiatives to avoid duplication, to build synergy, and support collaboration. Of course, the World Health Organization is a critical partner, as all the speakers have mentioned, and participated in the G7 Health Ministers meeting. So I think some of the added value of that brings further focus and energy to critical areas of global endeavor, including the work towards a global pandemic preparedness and response instrument. Second area, as noted by my colleague from the UK, is around the link on health and climate change into the COP process and the upcoming COP. I think there's an increasing recognition of the critical importance of adaptation strategies, and the very fragile health systems around the world, in particular in low and middle income countries, but facing all countries. And therefore the need to focus on health and climate change, which will drive future health risk, including infectious disease, as we know. The third area I'll just touch on briefly is the G7 discussions also touched on issues of health equity and, importantly, health inequities, both on a global scale and local scale. An important element in the presidency this year was the joint meeting of health and development ministers, including on issues of vaccine access. And importantly, in the communiqué noted a focus, again, a global issue, and something that G7 countries are aligned on addressing is on sexual and reproductive health and rights, which needs to play out a number of important fora, including in the context of universal health coverage.
Thank you. Mr. Ryan?
Yes, I think most of the issues that we're discussing in G7 are essentially global issues, and therefore I think it is very useful for the group of G7 countries, and in a wider sense the G20, to try and come up with a common identification of these problems and common approaches. That can only strengthen, I think, the capacity of the world community to respond to these challenges, which cannot be dealt with on the level of the nation state. And I'm saying that coming from the European Union, where we have 27 countries, which we also try and coordinate in a similar way. It's so G7 is one thing, G27 is another. You know? So we have a certain amount of experience here, but some of the topics we've been talking are really essential topics, I would say. The issue of pandemic preparedness, it's closely linked to climate change as well. We're going to see increases in animal disease, increase in vector-borne diseases. We're seeing them already. And identifying these diseases, these outbreaks in time, and developing systems and putting in place systems which can allow us to respond to these outbreaks, whether there's zoonotic or human outbreaks, will be extremely important for economic and for health reasons. So this is where I think we've got to look at the picture in the whole. AMR, we all know, it's called a silent pandemic, but it's definitely coming our way. And therefore, I think anything we can do in terms of developing our pharmaceutical legislation, developing a research agenda, improving stewardship, reducing infection, also controlling the use of antibiotics in the animal population, and of course, environmental spillover of antibiotics into the environment. These are all issues which we can discuss, because there's no point in one country doing something and the neighboring country not doing something else. And the leadership role, I think, at G7 is quite striking on these topics. And of course, the third issue on climate change we talked about earlier on, I think this is really something where the attention of the world has been diverted, whether it's because of the situation in Europe at the moment with an aggressive war being launched on our eastern borders, or whether it's because of the COVID situation continuing. So I really think that expanding these ideas and these concepts onto the international stage is something which we can do, for example, through the Pandemic Treaty, which we're discussing at the moment in Geneva, through the reform of the international health regulations. It's very important that we learn the lessons during the event, or as soon as possible after the event, so that we can reform these instruments, putting in place financial instruments which are adequate to make a change on the ground. So the financial instruments that are being put in place with the World Bank, for example, are extremely significant, I think. And then the discussion which the Japanese colleagues were planning to launch in their presidency on universal health coverage and equity. These are also examples of where the G7 discussions can have an impact on the world stage.
Thank you very much. We'll get into Q&A now. And what I'll do, ladies and gentlemen, is I will perhaps, I've noted to our online friends, I've noted some questions that have come in which pertain specifically to Japan's presidency. So perhaps we'll do that towards the end, so to say. But let me get some questions in the house. We have a microphone that's going around, and we can start in the front with the lady here, ma'am. Thank you. Yes, please. Please identify yourself and the speaker you would like to address your question to.
Okay, thank you very much. This is Emma Ross from Chatham House. This is really to all of you in the G7, and it really is, I'm wondering, you've all talked about how these initiatives need financing, and as if that's the next step. And I'm just wondering what your thoughts are on why hasn't the G7 already done that and stepped up? I'm hearing that in the global discussion, this is really, I'm wondering, how does the G7 see it? Does it see it as global health really needs to be a G20 issue that is not really for you anymore, and that really this should go to the G20? But then again, in the guise of showing leadership, I just wondered what does it take, and what are your feelings on how much of this is G7 responsibility, how much is G20, and when or how does the money come for these initiatives?
Thank you for that. And if you will allow me to, I'll actually address that specifically to Dr. Stefan, because you talked about financing, you talked about the WHO needing to be additionally funded.
Thank you for this, again, very important question. And I think we could spend at least one evening and one night to discuss financing and funding. But to be precise, I would see a twofold response to what you're asking. The first one is we should not start discussing funding without knowing what the funding should be for. So first, it's about the content, it's about the strategy, it's about what we want to achieve. And then the second is about implementation and funding, and not vice versa. Because, my experience is that normally you have a fair chance also with finance ministers to get the funding if you can convince people that you are doing the right things. And when you're in the middle of a crisis, in the middle of a pandemic, and I guess this is our experience in all the G7 countries, and you have to buy protective equipment, and you have to buy vaccines, then you get the funding from finance ministers, because it's all about how to best protect the people in the street. It's about your own accountability to the citizens, and how to best overcome this very serious crisis. So substance first, and then funding. The second one is funding should not just be based on a national funding, but funding is, in my view, part of that overall future architecture that we need on a global basis. And that is why my colleagues already referred to the now being under discussion new architecture involving also the World Bank as a really expert for funding and financing on the global level, to work closely together with the WHO to see what kind of projects in future times can be financed for pandemic readiness, especially for pandemic readiness. And if you look at the current state of play, and again, we will discuss that further in Bali next week, and with the G20 presidency, we have a very, very functional governance structure for that. We will have a board of that new financial intermediary fund, where we have, for example, a former finance minister to be one of the co-chairs. And we brought it together with a health minister as the second co-chair. That illustrates again that we have to bring the expertise on finance together with the expertise on funding. And we're exactly doing that as the G20 members and the G7 and the G20 members, to build up that new financial intermediary fund to make sure that we have a more stable basis for funding in future times. You will now maybe argue that this is not perfect, and it's of course not perfect. And by the way, my impression is funding will never be perfect, because you have so many projects on a global, on a regional, on a national level that should be funded. At the end of the day, it's always about setting the right priorities. But we as the G7 are convinced that with the pandemic readiness and using today's momentum, and we are still in the pandemic, we are still not out of the pandemic, we have to use that kind of momentum to set the right priorities and to build that kind of funding architecture with the World Bank, but of course, with the steering and in close collaboration again with the WHO. Thank you.
Thank you. Yes, just some more to your question.
Yeah, and I'll try to be brief. Just to say, I think we can see how this works in tandem with other processes, essentially. So if you see the G7 as setting part of the agenda, you can see us then going to the G20 to help fund that agenda that we set. I also want to be clear about where I think at least we have been stepping up and contributing. So, you know, you look to over $1 billion in the Financial Intermediary Fund, which I know is not totally where we want to be at the end of the day, but to have members of the G7 and other member states step up and make these commitments or contributions is important. We also just raised $14 billion for the Global Fund. So that's not nothing, right? And a lot of that came from G7 members in addition to other partners of the Global Fund, including on the African continent, which was critically important to see those contributions come through. So I do want to just be sure we're giving credit to those inside and outside of this room for providing those resources at a tough time in a climate where we are addressing so many issues, global health emergencies, global health priorities, and humanitarian and other important objectives across the board. But thanks for the question.
Thank you for the question. Okay, so I'm going to have to do things in a bit of an orderly way. Can I see all of the hands and I'll assign you a number so that we could get, right. So ma'am, I'll give you number 1. Sir, I'll give you number 2. Ma'am, number 3. And at the back, number 4.
Thank you.
Number 5. So let's do your questions quickly.
Yeah, no problem.
And what will help me is if you direct it to a single
Hello.
speaker, please.
Okay.
Yes.
This is actually this is a more general question, but if you would like to direct it to a specific speaker, then in that case.
Thank you for the powers. I'll take them.
Fabulous. My name is Alexandra Schuster, and I'm a mental health consultant with International SOS. I'm also on the Youth Commission. I'm on the Youth Council for the Mental Health Commission of Canada, as well as part of the Global Mental Health Peer Network. And my question is this. We all know that mental health is health, and we cannot address any health risk without considering the effects to mental health. Despite this, and despite this knowledge and the mounting evidence, mental health is often an afterthought, whether we're talking about pandemic policies or talking about environmental consequences, environmental health risks. So my question to all of you is this. What is the G7 doing to ensure that mental health is not only an afterthought, but a living, breathing part of all of the priorities you are addressing?
All right. Do I have any keen enthusiasts on this one specifically? Okay, while you guys are thinking, let's do questions. Canada? Okay. So, Dr. Lucas, I'll just take all the questions first, and then we'll do that. So let's go to number 2 and number 3 for the questions, and then we'll...
Thank you. Nick Tomlinson from the OECD. I'd like to pick up on Clara's comment about UHC with a question to Toshi. We know that health security is only as good as the weakest link, and we saw with COVID how one of those key weak links is the state of health systems in countries. So what can G7 do to ensure coherence between not 1 but 2 high-level meetings at the UN next year, one on PPR and one on UHC? And then critically, how can G7 accelerate progress on UHC to make up the lost ground that, as we've heard, has happened in the last 2 years?
Thank you. So that was to Dr. Ezoe. Did I get that right? Okay.
Thank you very much, Sarah Collinson from Sight Savers. We work to promote the health equity and rights of persons with disabilities and other left behind populations. My question, I think there was a comment a moment ago about using the processes around pandemic prevention, preparedness and response to set the right priorities going forward. I think we've noticed in those discussions there's a big focus on equity and inclusion, but there's potential for equity between countries to eclipse the importance of equity within countries. And actually, even in rich countries, we've seen really stark inequities in the response to the pandemic. I think in the UK, people with Down syndrome were 36 times more likely to die from COVID. But in poorer countries, those inequities are even greater, and they link into the question that's just been asked about UHC. So my question is whether these processes, amending the international health regulations and negotiating a new pandemic treaty, provide an opportunity to really shine a spotlight on health inequities within countries and addressing those, as well as between countries. Thank you.
Thank you for that, Sarah. And Ms. Winston, I will already tell you that will come to you. Would you like to take that as well, Ms. Pace?
It's okay.
Okay. Because I put UK in there at least. And then we do number 4 and 5. Were you number 4, ma'am? Sarah, were you number 4 with your question? You were 3. Okay, so we have to do 4 and 5 quickly, and then we'll get to the answers.
Thank you. Gail Carson, Chair of the Global Outbreak Alert and Response Network, a network with 22 years of preparedness and response. And I think most of the governments in this room have actually supported GOARN over the years. I'm just back from Nepal, and I'm actually wondering, how do G7 and others remain flexible and focused at the LMIC level? If anything, I learned more than I gave last week in Kathmandu. Nepal has a clinical network. They recruited the highest number of patients to recovery outside of the UK, 800 patients. They've got 52,000 community healthcare workers. They set up rapid response teams 20 years ago, and so on and so on. So I think, I hopefully went into that meeting in Nepal with humility, but I probably came out with even more humility and actually felt I learned more than I gave. So I ask you, how do you remain focused but flexible and really understand what the LMIC countries have to offer? Thank you.
Thank you for that. And then the final question in this round.
I was in the back, so. Okay, thank you a lot. This is Dr. Rawand Kamran from Iraq. I'm also a physician and also a member of Kurdistan Health Summit. It is a mini World Health Summit in the region and in the national. We are holding the 3rd Kurdistan Health Summit in December. So my question, it's not a question, it's just a monitoring of an example what's happening in this region, because I saw that G7 is talking about global health and equity and AMR. So I didn't hear for the Middle East and specifically for Iraq. I know they are the countries with the oil and rich, but for funding and what we are seeing in the field as physician, actually the quality of the hospitals, AMR issue, there is no any response for the plannings that are doing from the pandemic and from COVID-19. We learned that even a single country, it matters to be covered from health, because one region will affect the whole global. So my question, again, I don't know to whom it will be, but I'm asking all, what is the plan, actual plan, which is in the region for such an example as Iraq, where I live in? Thank you.
Thank you, Doctor. All right, so let's get underway with Dr. Lucas, that's right, on the question of mental health.
Thank you. I think we certainly recognize, both in Canada and in the G7 and broader context, and obviously including the World Health Organization, that we need to take a very holistic view of health and inclusive from broad perspectives, including mental health and consequences, including substance use. We have seen the acute effects of this in the pandemic, impacts on people around the world from all the dimensions of the pandemic, and I'd say in particular on children and youth. We also know of the impact of climate change, and climate change links to mental health, including after extreme weather events and impacts. And so at one level, it's built into the thinking and areas of focus. At another level, I would say there's an opportunity to further illuminate and bring out both understanding the mental health consequences of phenomena, including pandemics and climate change, and as well opportunities for targeted action. And I think in Japan's presidency, with a focus on universal health coverage, there's an opportunity to bring that out. It's also important to recognize that there are other fora where there are opportunities for discussion globally. And last week, Italy convened a meeting of the Global Mental Health Alliance with a focus there, building on previous leadership from a number of countries. I think maybe just to conclude, in many ways, it is an underserved and less supported dimension of health that we need to pay more attention to. And I think, certainly in response to your question, an opportunity for G7 to bring it more into focus as we look more broadly at health and its consequences and supports in a number of dimensions.
We'll do the question on UHC now, Dr. Zoe.
Thank you for the question on UHC. So the question was how to promote UHC. Well, the UHC is not new, of course, and it is not invented by G7. It has been embraced in principle, but especially due to the COVID-19 crisis, it should have a renewed attention and renewed understanding on how to promote UHC. So Dr. Tedros, the WHO, continuously is mentioning that no one is safe until everyone is safe. So to my mind, at least, so that to ensure that everyone is safe, the health system strengthening and the universal health coverage is necessary. And then so this is basically to ensure the basic health services at an affordable cost everywhere. We want to reinvigorate this concept. As I said in the beginning, we were busy tackling with the COVID-19, but while the political attention is still there, we want to capitalize on that to reboost this existing agenda of universal health coverage to ensure health for all. So, and how to do that? That is still, we need to crystallize the pathway, but the UHC 2030, for example, is doing that to plan for the concrete processes towards the high-level meeting on universal health coverage. And as you mentioned, there will be a high-level meeting on PPR, prevention, preparedness, and response. There's an idea that was endorsed this September in New York. So just to remind you that there will be another high-level meeting on tuberculosis in next September, supposedly. So we need to try to sort of align all these high-level health-related events so that it will produce meaningful synergy rather than competing each other. And this is not just a G7 business, but we hope that we can facilitate that direction with the overall objective of UHC as overarching goal. And under that, we could discuss mental health and other important health agendas. That is an open question yet, because we need to discuss with the members and also the community. But that is the basic idea that we want to promote. Thank you.
Thank you. Ms. Swinson and then Ms. Pace.
Thank you. So on kind of equity within country, just shows how complicated this whole picture is. Completely right. It's got to be both. I don't think it's one or the other. A couple of reflections on COVID from our country, as the questioner said. I mean, one of the, there's both a kind of good and a bad. Of course, the situation, sadly, is as set out, but it's actually the data and the scrutiny on COVID showed us that number very clearly, very fast. The transparency, the scrutiny on that. Sadly, it's the case for lots of other conditions, some of which there's data and research on, but some not. So I think it points to data, transparency, knowing what the impact is and knowing what has happened in country, whether that's broken down by condition or age or group, is a fundamental kind of basis of then being able to act on it, work with our services and service providers to eliminate that equity as far as we can. So I think it's really shone a light on that, not, whichever cut of different groups within country, you're quite right, alongside, of course, the equity pointed to from other questions for universal health coverage and needing to do both and.
Yeah, and in many ways, it points to why it's so helpful to have ministries of health or departments of health be at the table for these negotiations and conversations, because we have, sure, an international sort of perspective, but obviously we're operating from a domestic standpoint as well. And so it's our responsibility to be bringing that to the table for these conversations, to be, in my case in the US, recalling the data, very clear data that show how Black, Brown, and Indigenous people fared in this pandemic. But to Clara's point, I mean, Black women are dying at alarming rates from maternal mortality in the US, and people don't know or tell that story, right? And so we often are showing up at WHO with that perspective, and maybe that's something we should say out loud more. I also think it's important that domestic stakeholders get more engaged in this process. I will tell you, the domestic stakeholders who are involved right now are people who are focused more on mis and disinformation when it comes to these negotiations. I think that is less helpful when it comes to bringing issues of equity to the table. And it would be very helpful if people living with long COVID or other groups, obviously groups that focus on some of these racial disparities, racial and ethnic disparities, could be more familiar with this process and come to the table with some productive and constructive inputs to, again, hold us accountable in that regard and make sure this works not just across countries, but within countries.
Mrs. Sandhi?
If I may thank you. If I may wrap up some elements from your different questions, I think we do have a responsibility at the moment, which is not to invent shiny objects. I don't think this is what the world needs. We need to stick to very basic principles and objectives, including primary care, including universal health coverage, including ensuring that the most vulnerable groups in our populations can have an effective access to healthcare. And this is a condition for us to get a better protection against pandemics. In terms of financing, I think we are on the way. We certainly not have enough money to serve all the needs, but we have already made some progress during the latest months. I mean, the financing of WHO and so on. But it's not only a question at global level, it's also about ensuring that we manage to target domestic financing towards what delivers the best results for health and to protect the most, especially the most vulnerable, you see? So it's also about better financing our national and regional health institutions, you see? Not only a development issue, but also a question of choice and governance in our countries.
Thank you for that. Mr. Ryan, I'll come to you on the question about what the G7 can learn from low-income countries, as we heard from the lady's experience in Nepal, but perhaps also if you could tackle the input from the doctor from Iraq as well on that.
Well, it's quite clear. Our colleague from Iraq is quite accurate when he says that we're only as strong as the weakest link. And this is something which we're very much aware of also in Europe, because all the countries in Europe, even within the European Union, are not at the same stage of preparedness or capacity to respond. And that's normal because we have different profiles among our member states. And you can imagine, if you look at the global level, it's even more extreme, particularly in circumstances where you have civil unrest, or you have war situations, or you have post-war situations. And this is why I think it's really important that we work closely with international organizations such as WHO in order to identify the specific needs of countries which are in those types of situations, and that we direct targeted help to those countries to work with them to develop their health systems. Not only talking here about pandemic preparedness, by the way, I'm talking about strengthening of health systems more generally. So I think the way that the European Union would work would, generally speaking, be in the context of our cooperation with WHO and funding instruments which take account of vulnerable populations within countries, but also vulnerable health systems or destabilized health systems. And considerable investments are made in that respect, and we don't regard this as something which is entirely selfish from our point of view. It's a long-term investment. It's something which you don't invest in for 1 year. It's something you have to do over a number of years. The other point in respect of learning lessons, I mean, it's quite clear that there are cases where you can identify national systems which have strengths and best practices, perhaps, which can be scaled up and validated and used elsewhere. And that's not something we would have certainly any objection to. I think it's part of science that you do try and take up ideas and see whether they're validated or not, and then try and share those ideas. So one of the mechanisms we use within the European Union actually is in respect of these best practices, where we take, for example, diabetes screening in one country and then propose this to member states using European funding. So this is something which we would also see coming from OECD, coming from WHO, if they identify best practices which can be scaled up. We're fully online to support those. And finally, on mental health, let me say that the awareness of mental health issues has become quite extreme, I would say, as a result of the COVID pandemic. And President von der Leyen, President of the European Commission, announced in her State of the Union speech some weeks ago a major initiative on mental health. And that's something we're working on at the moment when we're not sitting here. And it will be the idea is to try and mobilize all of the European Union policy instruments, whether it's instruments in favor of children, young people, education, sport, any of the levers that we can pull, research, public health measures, but also employment law. So we'll be really trying to bring all of these strands together, and I think we'd be very interested in having discussions with other regions in the world, whether it's G7, G20, WHO, in order to see how our experience on the national level can be, again, this idea of picking up good practice and making sure that we're not doing something that's an outlier, but is something that's linked to what other people are doing.
Thank you for that. I'm going to just prioritize our online audience now. And the first question is for you, Dr. Ezoe. It's coming to us from Fiona, who is asking, how will mother and child health be highlighted under Japan's G7 presidency?
Thank you for a very straightforward question. And as mentioned already by Canadian speaker, maternal and child health, or PMNCH, or including SRHR, sexual and reproductive health and rights, was very strongly highlighted that under the German presidency this year. So, again, under the UHC umbrella, that should well be, we might as well. I mean, it is natural that that priority will continue. This has been a G7 continuous sort of like priorities. I think a Canadian presidency also highlighted in Muskoka. So this is a tradition in a way for G7. So although this is not decided, but we are expecting that to be highlighted again. Thank you.
You're not off the hook yet, because there is another one for you. People with disabilities have been disproportionately impacted by the pandemic, and I think I've heard that in the discussions today. The question is specifically about how disability has been part of discussions of pandemic preparedness specifically. And how that's going to feature in your upcoming presidency. So disability as it pertains to pandemic preparedness.
Do you have additional questions? Just to know beforehand.
For you, let me have a look and see. These are more generic. I think this would be the one. Do you want me to give you a moment to think about that, and I can perhaps ask the other questions while you're giving that a think? Yeah. And I mean, feel free, other speakers, continuity in the spirit of G7 to assist Dr. Zoe in that one. But somebody is talking about the, sorry, one moment, let me get this right. Coming to AMR. And the question is for representatives specifically from the US, from Canada and the EU. You spoke of the importance of addressing AMR, but several key antibiotics available globally for preventing and treating TB are not available in the US and Canada and in EU countries. I don't know which ones those are. So this includes a key first-line drug. Oh, here it is. Rifapentine, yes, rifapentine. And pediatric formulations of first and second line TB medicines. So can you comment on what G7 can do to address these types of reverse market failures and antibiotic access issues within the agenda to address AMR? So that's specifically for the US, for Canada, also for the EU. Who would like to start, Ms. Pace? Okay, let's go over there. C before E, that's right, alphabetical order. And let's keep it short and sharp because we're actually running down our time on the clock.
Certainly. I think as we've noted in the context of the work on AMR, there are both pipeline issues in terms of developing through research and development and clinical trials and innovative financing ways of pulling drugs forward. There are drugs available and market failures as noted. And I think part of the work under the German presidency, building on work from the UK the previous year, is looking at innovative financing mechanisms, ways that some of those market failures can be addressed to support both regulatory submission and then access to some of those drugs. Because of some of the niche applications and size of markets, global collaboration, and certainly starting with and including G7 partners is key in that regard.
Okay. Mr. Ryan, also short and sharp, please.
Short and sharp. It's really important to speak about these issues of antimicrobial resistance and availability of antibiotics in the G7 setting. There is an issue about putting our research efforts together. That's one point. Secondly, approaching the reform of our legislation so that we offer a suitable business case to pharmaceutical companies to manufacture and develop antibiotics in the future. That's something we're doing at the moment. Thirdly, the issue about how do you provide a market for these products without necessarily flooding surgeries with antibiotics, which the aim of which is not to be used except in an emergency situation. So the whole issue of stockpiles, for instance, is important. We have created a European system similar to the US system of BARDA, which we are actually tasking to work on the topic of developing new antibiotics and then working out the business case for these. And finally, of course, there's a lot to be done on patient safety and infection control, which we mentioned as well. So I think there's a whole series of topics which have to be addressed together and not just looking at the issue of the shortage of a particular medicine where we have mechanisms in place actually in Europe.
Space?
Yeah, it's an important question about not how we just focus on investments in innovation, which the US does do, but look at existing products and shortages. Also, an important reason why we need to look at synergies across these upcoming events, like the high-level meetings that Toshi keeps coming back to on both AMR and TB, knowing that they're sequenced in a way that allows us to connect those dots. I also want to take advantage and get back to the last question we had in the room around how this issue is being addressed in the MENA region. And for folks who are tracking or who might not be tracking, there is a ministerial meeting on antimicrobial resistance that's being hosted by Oman in another month or so, where some of us will be also having this conversation. So I didn't want that to go unspoken, that And in fact, the MENA region, and specifically Oman, has really been an important leader in the antimicrobial resistance space. Thanks.
Okay, I am just looking at the clock here, and to our audience member who asked about mental health, that one's been tackled, so I'm sure you're covered there. You asked about the G7 Pact on mental health, and we cover that ground. To our anonymous user who asked, audience member who asked about why the G7 did not influence health policy, where we had, and the word here is autocratic governments, and help the wider population. The context to this question is that during the pandemic, countries implemented different COVID testing methods. One was the PCR testing via hospitals, and then you go to a lab and the patient waits for a day. And then the other, which was more widely accepted, the audience member is suggesting, was rapid testing, where people test and isolate themselves when necessary. However, this was forbidden in some countries since some governments did not trust its own citizens about self-isolation. This is a bit of a difficult one. Have you understood the question? Anonymous audience member, because of the time situation that we are now having, and I still have to get back to the question about pandemic preparedness and disability specifically. Let's see if we have time after that, and we'll see how we can tackle that one. But I'd like to hand over to you now, Dr. Zoe.
Thank you for that question. So, again, under the universal health coverage, this is a comprehensive notion. And then, of course, mental health and physical health and disabilities issues are closely linked, and then they are necessary integral part when we want to achieve universal health coverage. So again, under this overall goal, we could include, of course, the specific agendas like disabilities and, of course, the other non-communicable diseases, for example, cancer control, diabetes, heart diseases, lung diseases, and risk factors. We can include all important elements, but just to be mindful that, as Lois was mentioning in the beginning, the idea is not to make a kind of like a Christmas tree, but we want to be succinct and really comprehensive at the same time. So this points have been very informative already, but we are really ready to continue to listen to your suggestions from the members of the G7, but from the overall global community. So thank you for those very important points.
Thank you. And just looking at the time, ladies and gentlemen, we do have to bring our conversation to a close now. I really wish I could have taken more questions in, but as we heard in the conversation, there will be more platforms for us to continue the discussion. And we look forward to our conversations in Indonesia and, of course, in Japan next year. Dr. Stefan, if you would please indulge me, I'd like to just give you an opportunity now to give us your final remarks. In a way, it's a handover, right, to your Japanese counterpart. So you can seal the deal for us this morning.
Thank you. Thank you, Madam Moderator. And I will immediately hand over the micro again to my Japanese neighbor. But to be honest, I think as a final words, you have seen as the audience the variety of topics that we have on the G7 plate. And what we discuss has an impact on the daily life of millions and billions of people on this planet. And that is why there is one element I would like to stress, and that was referred to in today's discussion. And it's an important element, but it's also an element which illustrates how complex the things are. And this is the element of the learning curve we are all in. And I think Lois Price referred to that at the beginning of the pandemic, no one in the G7 countries on a global level had a blueprint what to do with that kind of virus. We all had been surprised by that. But in all honesty, we all have taken our national approaches and we all then try to learn from each other, which is not yet finished. And of course, we also had to tackle, and we have to tackle criticism that maybe in some cases been the best way forward, and we are willing as free societies to deal with that kind of criticism, and again to go back to our societies and try to convince them that at that time it was the best way forward and it was evidence-based, and we are willing to learn from each other. And if I look back at the yesterday, what we discussed in the frame of the G7, when it comes to surveillance systems, there are a lot of national approaches in the G7 countries. And me, as the national civil servant, I have made my notes, and I will come back to my G7 colleagues, asking them very precise questions that what I can copy from their experience when it comes to surveillance. And this is also true in other areas. So the learning momentum is a very, very important one, and an honest and frank discussion about what went wrong and what can be done better next time is an essential part of the G7 debates. And in that sense, really, let me hand over to my Japanese colleague. We wish them all the success, and we are committed to contribute to that kind of success as the G7 countries. Thank you.
Thank you very much. And would you like to say something, sir? Or we could...
Sure.
Very enthusiastic, sure.
So just to remind you that the German presidency continues until the end of December. So I'm not being handed over yet, but thank you for your wise advice, and then we will try to continue your legacy and learning from your lessons and the lessons, globally. Yeah. So thank you very much for the session.
Thank you very much. And thank you to my panelists this morning. We've run down the clock, so I won't say all of your names, but thank you so much. And to the audience, those of you who've joined us online, to our friends in Italy, it's been good having you along with us as well. Thank you, ladies and gentlemen.